Schizophrenia is a mental health disorder that interferes with people's ability to think clearly, manage emotions, make decisions, and relate to others. Someone with schizophrenia may have difficulty distinguishing between what is real and what is imaginary. They may be unresponsive or withdrawn, and they may have difficulty expressing normal emotions in social situations. Schizophrenia usually appears around the ages of 16 to 30. And is very unlikely to appear after the age of 45. It can be difficult to diagnose in teenage years because many of the early symptoms are similar to normal teen behavior. Though there is no clear cause of schizophrenia, there are many theories for what causes the disease. One theory relates to genetic disorders. People who descend from relatives that have had schizophrenia are more likely to develop the disease themselves. It has also been found to most likely to appear after hormonal changes such as puberty or after a highly stressful event. Another theory says the cause is due to altered brain chemistry or structure. This can result from possible imbalances in neurotransmitters such as dopamine and serotonin. These imbalances can change the way people react to stimuli, which is why schizophrenics can be overwhelmed by sensory information. Also, problems in brain development early in life can lead to schizophrenia later on. The last theory on the causes of schizophrenia is that it is due to environmental factors. Schizophrenia may be triggered by environmental events such as viral infections or immune disorders. For instance, babies whose mothers get the flu while they are pregnant are at a higher risk of developing schizophrenia later in life. People who are hospitalized for severe infections are also at higher risk for developing the disease. Before 2013, schizophrenia was categorized into 5 different types. The first type was catatonic schizophrenia, which is marked by striking motor behavior such as remaining motionless in a rigid posture for hours or even days. The most common type was called disorganized schizophrenia. This type of schizophrenia contained disorganized thinking, inappropriate emotions, and the flat effect, which is a severe reduction in emotional expressiveness. Probably the most frightening type of schizophrenia for the patient was paranoid schizophrenia, which gave the patient delusions, hallucinations, which were both audio and visual, and also false beliefs. The fourth type of schizophrenia was residual schizophrenia, where all other symptoms go away and all that is left is the flat effect. The fifth and final type was undifferentiated schizophrenia, which meant that you didn't fit any of the other types because you had more than one type of schizophrenia. However, in 2013, the Diagnostic and Statistical Manual of Mental Disorders fixed the issue by changing the method of the classification to bring all of these categories or types under one single heading: schizophrenia. Some of the warning signs you may experience if you are worried about having schizophrenia is hearing or seeing something that isn't there, constantly feeling of being watched, change in body positioning, hygiene and appearance, change in personality, inappropriate or bizarre behavior including disassociation, and extreme preoccupation in religion or occult. If you are professionally diagnosed with schizophrenia, some of the symptoms you may experience include positive, negative, and cognitive symptoms. Positive symptoms are characteristics added to what a normal person may experience. These include hallucinations. These include both auditorial and visual hallucinations, delusions. This is firmly believing in something that contradicts reality, confused thoughts, confused easily and are sometimes not able to understand or process what people are saying, confused speech, words may seem jumbled and not make sense, concentration issues, can't concentrate on simple things, and irregular body movements, catatonic for hours, but patients can also be jumpy and make motions repeatedly and are not known to be violent. Negative symptoms are characteristics that are taken away from what a normal person may experience. These include loss of interest in things they used to do, and they are not able to do activities that they used to do. Having no emotions, they may not talk or show feelings. Withdrawal, they may not associate with other people and become hermits, and struggles with everyday life like not taking care of themselves hygienically. Cognitive symptoms are symptoms where the mind is impaired. People with schizophrenia usually possess thinking issues, which causes problems with remembering facts and having trouble remembering things. Schizophrenia can be treated, but it's usually a long-term disease or a lifetime illness that won't go away in a short period of time. One form of treatment to help it is psychosocial rehab programs, homes for schizophrenic people, and crisis services. These are some services that help people who have a hard time managing their lives at home due to mental illness, such as schizophrenia. They can call crisis to get the correct help needed and can move into these homes and programs if they are struggling with life at home or in the real world to receive the help they need. Another form of treatment is therapy or counseling. The utilization of therapy or counseling can be helpful when discussing the mental illness, in this case, schizophrenia. People can actively see someone and discuss their life and how they are coping with the illness. Another kind of therapy can come from self-help groups. Groups like these involve others who struggle with the same mental illness and can help the person by knowing that they aren't alone when it comes to dealing with it. Aside from therapy, medication can also be used to suppress symptoms. A common drug to help treat schizophrenia is antipsychotic medicine, typical and atypical. These medicines are known as major tranquilizers that can help suppress and reduce the symptoms of schizophrenia. Though schizophrenia does not affect many people, it is still a very serious mental health disease that deserves attention. The impact of this disease can be great and cause patients to go completely insane. Suicide is actually a common thought and want among schizophrenic patients. To stop schizophrenia, learning about the warning signs, some of the supposed causes, and the treatment gives people more insight on the disease, so if you or a loved one is experiencing it, you can catch it early.